the because they're
no
Turkish.
problem.
So I
That is
so
really nice. No problem. Fusun.
Okay. So our next session is on enhancing the capacity of health systems to overcome challenges and strengthening nurses and other healthcare professionals in COVID-19 process by Professor Fusun Terzioglu from the Faculty of Health Sciences at the Atelier University in Turkey. Fusun graduated in the first place from Hacettepe University. She won the H. Dogramak Superior Merit Award. Did I say it right?
Yeah.
Perfect. And she also won the Science Incentive Award. She's earned her pilot's license from the Republic of Turkey Ministry of Transport. Fusun studied counseling on assisted reproductive techniques at Liverpool Women's Hospital in the UK and has also earned a certificate in management and leadership in nursing. Fusun is an active member of the Thematic Network Leadership Work Group. She studied as a research scholar at Kent State University College of Nursing and worked on a project development of leadership skills in nursing doctoral students at the University of Michigan. Fusun worked as a research assistant at Hacettepe University School of Nursing, after which she climbed the ladder to receive the title of professor in the year 2012. She has worked as a co-head of nursing department, Erasmus department coordinator, head of strategic planning group, and board member of Hacettepe University Women's Research and Implementation Center between 2009 and 2011. Her subjects of interest are sexuality and reproductive health and management and leadership. Fusun is a member of national and international nurses organizations such as INDEN and Sigma Theta Tau. She's been working as a director of nursing services at Hacettepe University Hospitals and as a founding dean of the Faculty of Nursing. She has published more than 90 papers, 20 grant projects, 8 books as an editor and author, and more than 120 presentations nationally and internationally. And she spoke at more than 60 congresses and symposia. She is the founder dean of Faculty of Health Sciences in Sene University and director of nursing of MLP Care. Fusun currently works as the Dean of the Faculty of Health Sciences and Head of Department of Nursing at Atelier University. Fusun, we're all excited. The floor is yours.
Thank you very much. Thank you very much also inviting me for this great conference. I am also excited for sharing experiences about my subject. Also, it is very completed site after the Dr. Alina presentation about the leadership. So it is my subject is also focused on the how we empower of the healthcare professional in these perspectives, especially in the pandemic process. Also, it is in the COVID-19 process. So I would like to say something about this process. I think everyone live a lot of experiences during this time, and also we have a lot of experiences and a lot of difficulties living in as a nurse leaders or nurse practicing. We are know the COVID-19 is increased everywhere in Turkey, also in the world. But now some vaccination is increased, and I hope that we will control in the future, in a near future. Also, according to World Health Organization, the necessary criteria for a pandemics, the emergence of illness previously unprecedented in the community, the pathogen which is the cause of the disease, causing a dangerous disease by infecting humans. The pathogen which is the cause of the disease spread easily and continuously among people that is contagious. So we are living a lot of different kind of pandemic until now. Maybe our generation is living this kind of pandemics in all of the world. Every country is, every rich or poor countries is affected this COVID-19 pandemics, and health systems with insufficient number of health workers and healthcare equipment are extremely fragile. A failure to take timely intervention leads to impair of the existing health services, that of the healthcare workers who are responsible for the treatment of people affected by the pandemic, and thus public health to expose to great threat. The capacity of the healthcare systems to overcome difficulties depends on its ability to respond, adapt, and strengthen when exposed to crisis situation such as conflict, natural disaster, and sudden spread of disease. Regardless of the degree of difficulties, it is accepted globally that focus on providing healthy life, well-being for all age is the basis of sustainable development. The need for strong healthcare system that can be overcome these difficulties and response to rapid changes is at the heart of the UN SDG. Also, Millennium Development Goals suffer from the lack of healthcare workforce and the wrong distribution of the workforce. The scarcity of qualified health professionals, including nurses, is seen as one of the biggest obstacles in reaching the effective health system. It has developed a global strategy, Workforce 2030, on human resources in health. It was emphasized that all healthcare professionals should have a safe and human living conditions and be protected from all kinds of pressure and the violence. Also, maybe Dr. Aline mentioned about it, the toxic environment in the healthcare settings. Also, investing the health promotion and disease prevention, it can have a positive effect by eliminating the demands that people will make on health system with their health state and with the economic contribution of citizens who remain healthy and productive perspectives. This pandemic brought with it many questions. How to quickly intervene the deficiency caused by death or illness of healthcare professionals? How can we quickly train the nurse and other healthcare professionals to serve in different areas of the workforce? How can we quickly get the right equipment and effectively communicate with the community? The World Health Organization recommends long-term investment in 6 main areas corresponding to 6 basic principles: adequate number of trained health professionals, access to medicines and necessary medical materials, strong healthcare information system, including audits and monitorings, and creating appropriate infrastructure and adequate public funding, a strong public sector that will provide accurate and quality services. The goal of successful health systems is to be able to adapt, learn, and be flexible. These three main concepts are key factors in building and developing the capacity of to overcome the difficulties. What is the meaning for this one? Ability to learn. An organization which can be able to learn is promote the learning process of its members can constantly change itself. Flexibility is the ability of the organization to easily change its functioning if it works, labor force, employment, or services delivery models. Ability to adapt is the ability of the organization to adapt to certain situation or to work better for a particular purpose. What we can do, in the past pandemic, the Kirk et al. Identified 5 main elements for a health system capable of overcome difficulties. It is very proper for the COVID-19 process also, because ICN also recommended this kind of activities during this kind of pandemic process for the nurse leaders. Systems have the capacity to overcome difficulties, have awareness is very important issue, I think. This system use information to understand and model risk and intervention. The another one, comprehensivists. They can identify and overcome wide ranges challenges using the variety of resources such as maternity welfare service and labor capacity. During the COVID-19 process, most of country are living the similar things, I think, because most of pregnant women don't want to go to hospital for the birth. It was very dangerous for them, and also their kids, also their relatives. So it was very anxious situation for them. And self-regulated is important. They can identify and isolate hazards and still provide basic health services and create additional resources when needed. And integrated system, they establish strong links with key partners, communities, and institutions. An adaptable system, they can change themselves according to demographic needs, people who move in country, methods deliver the service, not only in times of crisis, but also normal times. Where should the reserve limited resources to establish health system that have the capacity to overcome difficulties be invested? And also in national health system is very important issue because all the contribution support from them. The another one, COVID-19 needs health system, it can be overcome difficulties, namely compatible, conscious and integrated system. And global public benefits and aid, the common interest of all the healthcare organization. The guide prepared by CIPD to develop the capacity to overcome difficulties has defined 3 approaches that individuals can apply to develop the ability of overcome difficulties. These approaches can be categorized under 3 headings: personality, individual altogether, and environment, and all of them. What we are saying about the personality or individual qualifications, the ability of overcome difficulties is personal, is seen as inner ability that forms part of individual's personality. And this can include the place of control in individual control over the one's life, the person's tolerance limit, awareness of their emotion and their management, their optimism, their perspective, sense of humor, self-efficiency, and ability to solve problems. Another factor is the environment. This depends on the interaction with the person's environment. In other words, factors such as how much social support they receive determine the level of the person's ability to overcome difficulties. The personality of the individual doesn't not relevant it. Both of them, when we look this kind of difficulties, it is the product of the individual's personality combined with environmental influences such as family, relatives, and social environments. The Robertson-Cooper model on the ability to overcome difficulties is very, very suitable with COVID-19 process. It's include that for different hiding, such as confidence, purpose, social support, and adapt. When we are saying the confidence, the effectiveness of dealing with stressful situation and strong self-confidence are the core of the feeling that difficulties can be overcome. It is important also how often individuals are exposed to positive or negative emotions. Purpose, the feeling of having a clear purpose, having a clear values for the person, the direction they have, ensure that people don't stop fighting and overcome them when they face advertisers. And social support, instead of the struggling with difficulties alone, establish good relationship with other people and seeking help provides people get rid of the negative situations more easily. Adapting to situations that are not in our own hands and being flexible are indispensable in having the ability to overcome difficulties. Individuals who can overcome difficulties better cope with changes and return to their state before they accept it, affected by the situation. How we enhancing health professional ability during this process? It is important to understand the relationship between the ability of healthcare professional to overcome difficulties and the ability of provide healthcare. A good working environment is important for physical and mental health. Some stress factor is high level of expectation in the work environment can negatively affect employers. Employers of healthcare professionals are expected to take a leadership role in modeling best practice in the system. Changes in professional practice, restructuring, and rapid changes in responsibilities, psychological stress may increase the likelihood of physical exhaustion, depression, and depressive disorders. The contribution of healthcare professionals and nurses in strengthening their health system and developing their capacity to overcome difficulties are indisputable. Nurses have many transformative changes within the health professional. Nurses lead important activities in delivery many services to people at all levels of the system, from decision-making to implementation. Nurses and other health professionals, to increase their impact and their pace of the change, they must be at central, flexible, adaptable, and open to new learning styles. During this pandemic period, three are priority areas. They need to develop the new skills needed for new expectation. The role of healthcare professionals and nurses in the application of digital technology, because in the academic and the clinical area, we more need in this talent all the perspectives. Power of to demonstrate quality and effect and system leadership. Application of digital technology, the link between the rapid changes in the healthcare system and communication technologies has enabled healthcare innovation to develop and spread faster than ever before. The level of nurses' readiness for computer or digital environment or informational technologies is important factor in the development of nursing informatics and information system. Nurses and other healthcare professionals should be leader of the technological system and should develop and promote an understanding that technology can improve quality and patient safety and can radically change healthcare methods. And in another word, nurses working in these fields of services and application to have information literacy skills, including computer literacy, which are defined as noticing the information needs, accessing the information needed, using this information effectively, evaluating and presenting it. Power to demonstrate quality and effect. The extent of which nurses can demonstrate the quality and effect of their work is an important point in ensuring that the rest of the system understands and values the roles of nurses have. Therefore, nursing expertise should be visible at all levels of government and decision-making mechanism and should be valued because of the important role that quality healthcare has in reaching citizens in the healthcare system. System leadership, classical leadership model, which are based on the single organizational model linked to the hierarchical organizational structure, will become unsustainable. Especially in the public sector leadership, organizational, professional, and geographical boundaries are blurred as services begin to integrate resources and shared and personal are employed through many different methods. All leaders' center of gravity should now shift from commitment to their organization, commitment to citizens and wider population. System leadership is two separate but also interrelated features is included. One of them, the collaboration, the other one, the crossing borders. Organizational and professional and personal, so leaders can go beyond the limits of their usual responsibilities and power. And healthcare professional in an individual situation should improve their skills to demonstrate the positive impact and high quality nursing practice on patient outcome. Protect your health and well-being, also very important issue. Improve the ability of patient to undertake individual care. Improve their methods of the generating ideas on the health system by establishing strong association within the system. Improve their ability to overcome difficulties, priorities. Support your colleagues to improve these features. Institution and employer also has some responsibility in this area. They have to provide a positive work environment for healthcare professionals and support the health and well-being of healthcare professionals and provide learning opportunities for employers and ensure critical case evaluation in the organization. And also they have to make disaster plans. Decision makers enact to enforce laws that provide a positive work environment and protect healthcare workers, plan and manage your healthcare workforce appropriately, and create a healthcare human resources plan and implement it effectively. Accelerate to transition from the disease-oriented system to the understanding of preventive healthcare and health promotion. Ensure planning to overcome difficulties is part of the strategic development of the health system, and enable nurses to take part in decision-making mechanism for optimal use of nursing skills in system. Also, the National Professional Association has a very important role in this area, enable the effective health policies to support them to maximize the contribution of profession for health professionals to work at the optimal level. Support healthcare professionals in the healthcare sector to ensure the highest contribution of healthcare professionals at all of levels of the system. It is necessary to work together to create a strong health system that have the capacity to overcome future challenges in order to achieve the goals specified, sustainable development goals. When a process such as COVID-19 was added the cause of a pandemic, left our lives under the control of uncertainty. More than one crisis situation emerged that both institution and healthcare sector should manage. The important point is related how we manage the process and lead this process in these extraordinary situations we encountered in the quantum era.
Professor,
To know that
yeah, Professor, just 7 more minutes.
I know I finished my, okay, I have more to slide. They know what people think, what they want to hear, how they want to hear the announcements. They can improve corporate justice with their ability to blend all this information. Nurses, a large part of the health services to people by collaborate the health sector and their colleagues outside this sector have important role in this process, and we have to prevention of uncertainty, speed, and analyzes the 3 most important criteria in the problem solving and crisis management in the past. Employee safety, focus on the bigger target, community involvement, empathy, turn of the crisis into the opportunity is very important issue. We have to supply the personal protective equipment, and we have to take the community involvement and focus on the bigger target, because the compliance with hygiene rules, following the social distance rules, taking protective measures, avoiding close contact, social isolation, etc. Focus on bigger target. It was a period their health responsibilities and increased awareness of sensitivity, empathy, turn off the crisis into opportunity. And the Chinese crisis approach consists of 2 parts. Danger, we have to change to opportunity. So we have to create a change in terms of growth and using different opportunities. So as a result, I think the knowledge is the slip that it comes to life begins the power. So we have to collaborate to each other, we have to support to each other, and we have to know to each other, so we will solve all kind of problems as a teamwork. Thank you very much for your listening.
Thank you, Professor Fusun. Thank you for putting together this invaluable review of information and data that was merged beautifully. I heard a lot in your session, a lot of affirmation that coping and resilience and hence the significance of developed emotional intelligence competence. You spoke about emotional reasoning that I would like to highlight because it's very important. Emotional reasoning is basically an emotional intelligence competency, which is involving the people in decision making when decisions and actions affect their own area of practice. And you have mentioned that, and this is essential. Thank you again. And
welcome.
questions and comments, please. Anybody has a question to Professor Fusun?
It was very clear, I think.
You have put together a great review of information and data for sure.
Thank you.
I also want to highlight that you spoke of collaboration, and collaboration in times of uncertainty and in times of crisis is very important, because collaboration is everybody putting in what they can without saying, I put this and you put that and who did what. It's just all these joint forces together so we can reach the goal, which is securing the safety of our staff and hence the safety of the population. So great review of
Thank you.
data information. Thank you for that.
It is a pleasure for me. Thank you. Have a success in the conference. Thank you.
Thank you very much. I think it's time for our 10-minute break. So we are going